Hi, I'm going to show you how to use your insulin administration device. This is called an Innolet, and the type of insulin that you're going onto is called Protophane. And if you can't remember the name of the insulin, just tell your doctor or nurse that it has a green button on it. So first thing you're going to do is take the cap off the device and put it down on the table. Your Innolet is a disposable device, meaning that the tube of insulin comes already in the pen for you. When that tube of insulin is empty, you throw the whole device away into the garbage and you get your new one out of the fridge. Okay? Step 2, your insulin is what's called a cloudy insulin, meaning that there's a mixture of insulin in it. And the insulin is like powder, and you need to resuspend the powder. And to do that, you're going to go like this. Have a look. When it's consistently cloudy, you're ready to go. You're ready to go on to the next step. If you see any white chunky bits in here, keep mixing until it's nice, consistently cloudy. Okay, the next thing you're going to do is put your needle on. Your needles are free from the chemist using your Diabetes Australia card. Alison and Jill will have upgraded that for you. This is what the needle looks like. First thing you're going to do is peel off the piece of paper, like so, and you're going to put it onto the round end of the Innolet, like so. Screw it on till it becomes firm. You don't want it to be so tight that you can never get the insulin needle back off, because you're going to put a brand new needle on every time and you're going to take the needle off every time. Okay, so the next thing you're going to do is take the first cap off and you're going to take the next cap off. So you can see that the needle is actually really very, very small and it's very fine. There's no way that the needle's going to go through your tummy into the baby's head or any part of the baby's body. Okay. Next step is probably the most important step, and it's to make sure that the insulin device is working properly so that you know that you're going to get the correct dose of insulin. So we call it a test shot or an insulin flow shot. And to do that, you're going to use this center dial thing here and turn it around to 2, and you can listen to the clicks. 1, 2. See, 2 on. Hold the device upright, push on the green button on the end, and make sure that you can see insulin coming out. You'll also notice that it's gone back to 0, which lets you know that that amount of insulin has been expelled through the needle. If you do that step and you don't see insulin coming out of the needle, repeat it again. If you don't see insulin coming out of the needle, take that needle off and put a new one on. Try it again. If you don't get insulin coming out at that point, you need to get a new device and start from the beginning. Okay, the next step is to dial up your dose of insulin. So we're going to make, just pretend you're starting on 6 units of insulin. Usually this would be given before you go to bed at night. So you're going to turn your dial around to 6. 6 units. You're going to inject, you can inject into the front of your tummy, but if you're feeling a little bit uncomfortable about doing that, just go further around to the side where your tummy's not quite as tight. Not to be given through clothes, so just lift up your shirt. I'm just going to use this because I don't need insulin. Hold the device lightly in your hand. Don't hold it with your thumb over. So hold it in and you just go in a gentle motion. 1, 2, 3, in. Push down on the green button until you see the dial come back onto 0. Keep pressure on the end of the device on the green button and count to 10, 6, 7, 8, 9, 10, and then remove. The next thing you're going to do is take the needle off, and you can see that I've actually bent that needle, but that won't happen to you. Use the big cap only to take the needle off. Don't try covering it with this little one because that will hurt when you stab your finger. The big cap goes over the top and you unscrew the needle. The needle cannot go into your normal garbage. It must go into a sharps container. So you can buy one like this from the chemist, which it can go into, or as long as it's a hard plastic container that has a lid that fits tightly, that will be fine. So such things as your SARDS soap containers, or the plastic fruit jars that have a screw top lid. So the needle goes into and you're finished. It's very scary starting insulin, but it's actually a great way to manage your gestational diabetes. It doesn't hurt. I've done it to myself, and all of us, we do this on a regular basis so that we can sit here and tell you. Pricking your finger actually hurts more. So don't be scared, give it a go. We'll talk to you next week.